Good afternoon, everybody. Welcome to the next lecture in our Advanced Wellness series. Today we're going to be talking about raising healthy kids. I'm Dr. Bemis. I'm a chiropractor here at Lakeland Chiropractic, and I hope you enjoy what we have for you today. I want to start today's presentation by asking you a question. Now, what is your greatest asset? What is the most important thing in your life? Could it be your house, maybe a fast car, or the money that you have saved up in the bank? Well, if you answered yes to any of these three things, while they are all important, none of these are your most important asset. Your most important asset is your health. A relatively recent Harvard study showed that medical expenses account for roughly 62% of all bankruptcies in the United States. And even more astonishing, roughly 72% of those people that filed bankruptcy had some form of health insurance. So your health is your greatest asset. Without your health, you can't enjoy that fast car, you can't enjoy your time with your family, and you can't enjoy spending all that money you worked so hard for and saved up. Now, we're in the middle of a health crisis here in America, specifically when it comes to the health of our children. Look here. In 2015, it's estimated that 17% of American children are obese. 17%, and I can promise you that number has only gotten bigger since then. In 1990, 900,000 American children were on Ritalin. Today, the number has increased to at least 4.5 million. So almost a five-fold increase in the number of kids on Ritalin since 1990. Children receiving the standard medical treatment for ear infections, which is antibiotics, we'll talk about that in a little bit, suffered 2 to 6 times more recurrent infections. So because they were on long-term antibiotics, they actually got diagnosed with 2 to 6 times more ear infections. How about right here? 12 million children in the U.S. under the age of 18 experience one or more learning, developmental, or behavioral disorders. And lastly, more than 17 million children worldwide have been prescribed psychiatric drugs. Of these 17 million, 10 million of those are here in the United States, being prescribed addictive stimulants, antidepressants, and other psychotropic drugs for educational and behavioral problems. We've got a problem here, people. Now, the only way that these numbers will go down and disappear is if we stop just addressing the symptoms that we see in our daily lives and get to the root cause of what's making these things occur. And the best way to do that is to understand the difference between the two health paradigms and the philosophies that they're rooted in. So first we'll talk about mechanism. Today's traditional medical model is heavily rooted in the philosophy of mechanism. And mechanism is a doctrine that holds that natural processes, as of life, are mechanically determined and capable of complete explanation by the laws of physics and chemistry. What does that mean? That means that according to mechanism, you're just the sum of your parts, and if one of those parts isn't functioning properly or it's not working the best, we could just cut it out, and if we're able, replace it with a new one, and you'll be just as healthy. That's what mechanism says. And I'm not a big fan of that because you can't just add and subtract parts of the body and expect it to function at 100%. A kind of super intelligence exists in each of us, infinitely smarter and possessed of technical know-how far beyond our present understanding. Lewis Thomas, he's a medical doctor, he said that, and it ties very nicely into our next topic, or the opposite of mechanism, which is vitalism. Now, chiropractic is rooted heavily in vitalism because chiropractors recognize that there's innate intelligence or a life force that governs your body, and if provided the right conditions, will allow you to function at 100% and be 100% healthy. So vitalism states, vitalism is a doctrine that the functions of a living organism are due to a vital principle distinct from physiochemical forces. So you can't just explain away your problems or how your body functions based on the laws of chemistry and physics. Rather, vitalism is a doctrine that states that the processes of life are not explicable by the laws of physics alone, and that life is in some part self-determining. That's what we talked about on that last slide. The innate intelligence within you has already predetermined what your life will be like. If provided the right conditions, you'll live a life of health and vitality, whereas if there's a lot of interference to your body, you'll live a very diseased and sick life. So as a chiropractor, I recognize that there is an innate life force in your body that governs all the processes that are currently going on within your body. So chiropractic concerns itself with the innate or inborn intelligence that travels through the nervous system to direct all your organs to carry out their daily processes. So as a chiropractor, I'm concerned with the state or the health of your nervous system, and we affect the nervous system by checking what we call for vertebral subluxations. So a vertebral subluxation is a misaligned bone in the spine that puts pressure on a nerve or interferes with the nerve's ability to function, resulting in a decreased state of health for whatever organ is at the end of that nerve. So I make sure that your spine is in the best possible posture so that you can live an optimal life full of health and vitality. And the life within your body, or that innate intelligence that governs every single process within you, travels along what we call the master system. Another term for that is the nervous system, which you've probably heard of before. Now, the nervous system consists of 3 components. Number 1 is the brain. The brain is the generator that controls every single cell, tissue, organ, and function in your body and directs the messages to the external organs. Component number 2 is the spinal cord. It runs down the back of the spine, connecting to component number 3, these nerves. The job of the nerves is to branch out from the spine and carry whatever message started in the brain to the target organ at the end of that. And remember, the spinal cord and these nerves are exiting the level of the spine, or exiting through the spine here. And if one of those bones is misaligned, it's going to interfere with the transmission of that life force from the brain to the organ. So it's because of this intricate network of neural tissue that your body is capable of transmitting 640 million messages per minute. Think about that. You know, it would take you a couple days to count to that number, let alone actually transmit that many messages per minute. And you don't have to think about any of this. Lastly, every single one of your 100 trillion cells are in constant communication with your brain and with one another because of these nerves. So now that we discussed what I do as a chiropractor and what a subluxation is, how do you get them? And namely, because we're talking about growing healthy kids today, how do your kids get subluxated? Well, the most obvious source of subluxation in a child would be physical stress. Now, that can occur due to any number of things, but for the purpose of this presentation, we'll break it down into a couple main bullet points. Number 1, physical distress of childbirth. We've got a slide on that a little bit later, but the birth process can be incredibly traumatic to a child. Excuse me. The birth process can be very traumatic. Learning to walk, we'll talk about this in a little bit too. Learning to walk has a profound effect on the health of our spines because, you know, anyone that's watched a kid learn how to walk, they're constantly getting up and then falling onto their bottom time after time again. Extended time in car seats. Kids aren't meant to lay in car seats for hours a day. Unfortunately, some are stuck there. Sporting activities. You know, as your kids get a little bit older, they show some interest in sports, you know, namely a contact sport like football. If you've got a young kid playing football, it's incredibly imperative they're getting their spine checked because if they get a subluxation pattern in their spine at a very young age and it's not addressed, it could reinforce itself there. And lastly, poor posture. This little guy is right here watching TV. You can see all the strain being placed on his neck, and not to mention, he's a little close to that television. Another physical cause of subluxation is when your child carries a backpack that might be too heavy for themselves. So a study by Land's End Direct Merchants found that more than 96% of children ages 8 through 12 will carry a backpack to school this year. Of those, nearly 1/3 will carry their backpack improperly. Now, it's estimated that a backpack weighing more than 12 to 15% of your child's body weight, the numbers are conflicting, I've seen it go both ways, so anywhere from 12 to 15% of your child's body weight, anything more than that can be detrimental to their health. So let's say you've got a young kid and they weigh 50 pounds. You know, a backpack weighing more than about 5 to 7 pounds is really going to cause some problems to their little spine. And that doesn't seem like a lot because we've just been trained that you have to fit everything in your backpack. And you see these kids carrying these massive backpacks around, and it makes me shudder when I see it. So here's some tips for backpack safety. First, we'll look at this diagram. Now, this does a great job of showing what happens when someone carries a big backpack and only uses one strap. You can see there's some straining on this side of the neck because he's trying to right his body to support the weight. There's a pinch point here on the shoulder. The thoracic spine is going to laterally flex, so that could cause some stress and strain there. And then this could also impinge the hip and the lumbosacral joints right there. So some health tips for backpack safety. Number 1, choose right. It's really important that you choose a backpack for your child that isn't too big for them. Sometimes I'll see little kindergartners that are, you know, this tall carrying a backpack that's this tall. It doesn't work, and it's not good for them. Number 2, pack right. You know, your backpack should not exceed 50% of the wearer's body weight, and it's important to note that you pack the heaviest items closest to that person's spine, so furthest back in the backpack, because then that won't throw off their center of gravity as much. Number 3, lift right. It's important to lift your backpack off the ground with your legs, so squat down and pick it up this way, rather than use your lumbar spine as a hinge joint to pick that backpack up. And lastly, we talked about this a little bit earlier, wear your backpack properly. It was made with 2 straps for a reason. It's really important that you use both of those straps. Since we're on the topic of posture and how it affects the spine, we're going to talk a little bit about text neck syndrome. Now, you may have heard this term before, and text neck is the term used to describe neck pain and damage sustained from looking down at a personal device for an extended period of time. Text neck will affect both children and adults alike, but really, anybody who spends any time looking at a personal handheld device or staring at a computer or watching television could be the victim of text neck syndrome. Now you can see right here on the left, this gentleman is in nice neutral posture. There's 0 degrees of anterior neck tilt, so this is me standing in neutral posture. And then this is what neck tilt looks like on a real person. So here in neutral, you can see there's 0 degrees neck tilt. The amount of force on the neck is anywhere from 10 to 12 pounds. Coincidentally, that's the average weight of a human head, or for an adult. As you progress from normal over to the right here, you'll see the amount of neck tilt increases, and also the amount of force on the neck will increase as well. So it's estimated for that about every centimeter of anterior head translation, the weight of the head will double on the spine. And this can cause a lot of stress and strain on these tiny little ligaments and muscles that help support that spine. So if you've got to spend a lot of time looking at your cell phone, or you just want to, bring it up to eye level so that you're not straining your neck in the process. Scoliosis is another common condition that we see a lot of in our office, especially within our pediatric population. Scoliosis is a condition of the spine that affects roughly 2 to 3% of the population, with the primary age of onset being between 10 and 15 years of age. In other words, that's when you first start to see it in people. It'll occur equally in males and females, but females are actually 8 times more likely for their scoliosis to progress to the point where some sort of treatment or intervention is necessary. And lastly, it's important to note that the vast majority of scoliosis cases are idiopathic, meaning they have no known cause. So you can see right here, this is what a scoliosis looks like on x-ray. There's these big lateral curves in that person's spine. And actually, if that person gets into a chiropractic office at an early enough age, we can get really good results correcting some of these lateral curves out. It might not always be perfect, but we can achieve some really good structural corrective results throughout the course of chiropractic care. The second major group or cause of subluxation would be chemical stress. Our environment is becoming incredibly more toxic due to the chemicals within it. So kids will come into in contact with these compounds on a daily basis, namely from the source of household cleaning products. A lot of the products that we use to clean our house, some of them can be pretty nasty and have a lot of big chemicals in there that could be toxic. Pesticides and hormones in our food supply is becoming incredibly more toxic on a daily basis. Atmospheric pollution is another big source of toxic chemicals for our children. And lastly, certain vaccines have some compounds in them that could be hazardous to your child's health. Now, as our environment becomes more and more toxic and we're taking all these toxins in, your body and your liver can only process so many at a given time. And once your liver reaches maximum capacity, some of those toxins have to store themselves within your body, and that could overload certain organs and cause some health problems down the line. The third and final cause of subluxation in children we're going to talk to is emotional stress. So, our kids are more stressed out today than they ever were, and that could be due to things like bullying, family marital issues, body image issues, depression, anxiety. Remember that first slide where we looked at where 10 million American children are on psychotropic drugs for depression and anxiety? Yeah, that's because depression and anxiety are a very big problem in our pediatric population. So when you're constantly having all these external stressors come at you and you're in an emotional state of distress, your body is in a constant state of fight or flight. Your sympathetic nervous system is working in overdrive, and your body is under a constant barrage of the hormone cortisol, which is the stress hormone. So emotional stress is the third cause of subluxation in children. So now you might be thinking, well, why does my child need to be checked? If you think of chiropractic under the false premise that chiropractic only fixes neck and back pain, you might be right. Your kid probably doesn't have any neck or back pain at such a young age, but that doesn't mean that they still don't need to get their spine checked. See, chiropractic is about so much more than just getting rid of neck and back pain. Remember, my goal as a chiropractor is to make your spine as close to textbook normal as possible and minimize any interference in the form of subluxation to your nervous system. So by removing the interference to the nervous system, you're freeing the nervous system to function at 100% and increase the overall health of the human body. We're going to talk about 2 chiropractic studies right here that show the importance of why kids need to be checked. So the first study was by Del Rosso, and he found that on average, before the age of 7, a child will fall anywhere around 2,500 times. So that's 2,500 times your little one is going to fall on their bottom, which could injure the low back. It could cause some problems in the sacrum or the pelvis, and namely, it could reinforce a subluxation pattern at a very young age. Another study by Gutman looked at 1,000 infants, and he found that roughly 80% of them had some form of nerve dysfunction after childbirth. So 80% of his entire population of 1,000 infants had some sort of nerve dysfunction, and we'll talk about what that looks like in just a little bit. Another reason your kid needs to be checked is because there may have been some sort of birth trauma during their delivery. The 3 common causes of birth trauma: number 1 is constraint or abnormal positioning in the uterus. Now, this is your baby that's breech. You know, they might be laying transversely, they might be sitting upright where the head is in the opposite direction of where it should be. I know when I was born, I was a little bit of all 3 of these. So I actually came out foot first, which isn't right. So that led to an emergency C-section with a lot of twisting and pulling to get me out of my mom to make sure that I was safe and healthy. Number 2, spinal distress from the journey through the birth canal. I'm taking care of a little guy right now who actually got hung up in the birth canal for an extended period of time. He's doing great, but that was a very traumatic situation for that little baby on his first day of life. So this is when there's any kind of complication coming through the birth canal. And number 3, spinal distress during the delivery itself through the use of external interventions. These are your vacuum extractors or your forceps. You might see a newborn baby with some bruising on their head, or their head might be a little misshapen and bruised. That's because of these external interventions designed to get the baby out of mom as quickly as possible. And now granted, all these things are designed with mom and baby's health in mind, but what's not being considered, you can see right here, is all the twisting and pulling and force being applied to that little one's developing vertebrae. See, his bones aren't even fused together yet. So this is going to have a negative effect on the overall health and development of his spine, and that's why it's incredibly important that this little guy gets his spine checked at a very early age to make sure his nervous system is functioning at 100% and his spine is clear of subluxation. So here's some of this slide right here shows some of the effects of undetected nerve dysfunction in young children. And so nerve dysfunction in children will manifest itself in things such as breathing weakness, frequent spitting up or vomiting. I know anyone that's spent any time around a little kid, they'll see a lot of that. Irritability of stomach or colon, colic. Colic's a big one. We see a lot of that in our office. A lot of parents bring their kids in because they've heard chiropractic helps with colic, and it does. And it helps because you're removing interference to this little one's nervous system, not because we're treating colic. Difficulty with feeding and attachment, that can be a problem in the pediatric population sometimes. Sleeping problems, I know everyone would love for their kid to sleep a little bit better. Biomechanical problems, this is your scoliosis, which we talked about a little bit earlier. Ear infections, vestibular trouble such as balance issues, headaches, this might be in your kid who's a little bit older. Hyperactivity, behavioral disorders, neurological defects, and lastly, visual disturbances. You know, these are all the various manifestations of nerve interference in kids. And you might say, well, this encompasses pretty much everything in the scope of what a little kid could go through. And that's right, it can. That's because your nervous system is responsible for the control of every single function in your body. And if it's being interfered with and not functioning at 100%, various systems throughout your child's body could be affected by that dysfunction. One of the big reasons that we see a lot of kids in our office, namely really young patients, is because of ear infections. Now, an earache or an ear infection occurs due to swelling of tissue in the middle ear that closes off the eustachian tube. So now you might be wondering, how can chiropractic help get rid of an ear infection? I thought the only way to get rid of those were from long-term antibiotics or putting tubes in the ears. Well, the current medical treatment is antibiotics and surgery, but chiropractic can actually help because if there's a subluxation in the cervical spine, so remember, if an upper cervical bone, namely the atlas, the first bone in the cervical spine, is subluxated, it can cause a spasm of the tensor veli palatini muscle. Now that's a big fancy term, and it's a small muscle that attaches around the eustachian tube, and if spasming, it will actually close off that tube. Now the tube is occluded, and that will result in fluid buildup in the middle ear because that tube can't drain the fluid and get rid of it. And then when that fluid gets there and is stagnant and it isn't draining properly, that's where you get your bacterial infection from. So your bacterial infection actually might be occurring due to a misaligned bone in the spine. Not to mention, a young child's eustachian tubes are parallel with the earth, so they don't get the added benefit of gravity like adults do, whose eustachian tubes are more slanted and they can drain properly. So ear infection will create pressure and could cause a possible bacterial infection, and it will result in changed behavior or sleep patterns. You know, when I was a kid, I suffered from chronic ear infections. I was on antibiotics for the first couple of years of my life, and luckily it didn't get to the point where my parents put tubes into my ears, but I really wish that someone would have told them when I was a little guy going through, you know, ear infection after ear infection, sometimes double ear infections, that, hey, why don't you get your kid to a chiropractor and see if his atlas isn't subluxated? That probably would have done me a world of good. So your child's health is their greatest asset. And this list right here shows all the many reasons that people bring their kids in to see us as chiropractors. Now keep in mind, they're not bringing, well, they might be bringing us in to get rid of a certain condition, but myself and the other doctor here in this office, we're not treating any specific condition. All we're doing is removing the interference to that kid's nervous system. Number one, maximize brain plasticity. This is your brain and nerve development, and it's estimated that roughly 65% of neurological development occurs within your child's first year of life. So that's another great reason why it's really important to get that kid's spine checked and make sure their nervous system is functioning properly. Number two, enhance overall health and well-being. Strengthen immunity and reduce the incidence of colds, earaches, and general illness. If you look on our YouTube page, I did a talk a couple weeks ago about how chiropractic can help boost immune function. If you have any more questions about this, refer to that. It's got a lot of good content in it. Chiropractic can help with colic and irritable baby syndrome. It'll help with asthma, breathing difficulties, and allergies. Improve spinal posture, improve the ability to concentrate, assist with behavioral disorders, alleviate bedwetting and digestive problems. Upset stomachs and digestion issues such as constipation is a big problem with little ones sometimes. We see a lot of kids in our office for that. And lastly, assist with sleep issues. I love this quote right here. It does a really good job of summing up how I feel about one's health. So health cannot be measured by simply by how we feel, but rather by how well our body is coping with the stress that we place on it. We're constantly being barraged in our daily lives through various stressors, and how our body functions and responds to that stress is the only true way to gauge how healthy we are and how well our body functions. One of the biggest misconceptions that we're taught in our society is that if you don't have any symptoms, you must be 100% healthy. Well, that's really not the case. According to the World Health Organization, true health is a state of complete physical, mental, and emotional well-being, and not merely the absence of disease or infirmity. In other words, health is not just feeling good. So just because you feel good doesn't mean you're 100% healthy. It actually takes 50% loss of function within an organ or a process in the body before your body will even let you know that there's something wrong in the form of a symptom. So you can't gauge your health totally on symptoms. Rather, health is having a body that's capable of performing all of its many functions normally. Symptoms really get a bad rap. Are all symptoms bad? Well, I can tell you they're not all fun, but they're actually serving a really good purpose. See, symptoms are your body's innate warning system to let you know that something's wrong. Think of the common cold. I don't get a cold very often because I get adjusted regularly, but when I do come down with something, I get my joints get achy, my muscles get sore, I get really congested. Now, am I going to go continue my regular workouts? Am I going to go run a couple miles that day? I could if I was going to be silly, but that wouldn't be very smart. Then I wouldn't be listening to my body. See, my body is making me experience these symptoms to tell me you need to slow down and rehydrate and allow proper time to recuperate. Another example is food poisoning. A couple of the primary symptoms of food poisoning are diarrhea and vomiting. You eat some bad food, a couple hours later, maybe even minutes unfortunately, you're running to the bathroom trying to expel that bad food you just ate. You're not doing that just by coincidence, but that's your body's innate response to ingesting bad food and trying to get those microbes or that bacteria out of your body as quickly as possible to minimize the damage that's already been done. So while all these examples of symptoms may not be very fun or enjoyable, they're 100% necessary to indicate proper function within your body and let you know how your body is performing. We're just about to close up here, but I want to talk about some of the facts of fevers. So I don't know about you, but I was always told that 98.5 degrees or 98.6 degrees is normal body temperature. That's just what I've been told since I was a little kid. But in actuality, some people's normal resting body temperature might be a little bit higher, while someone's might be a little bit lower. I know I'm about 98.2 on a regular basis, so I'm a little bit lower, and I'm technically not normal, and that's okay. Now, another big misconception is that fevers are bad. If your kid's running a fever, they're sick, we got to get rid of that fever, make the fever go away. Well, you really don't want to make that fever go away because for all children above the age of 3 months, a fever is actually a good thing because it's a sign that their body is functioning properly. See, fevers are your body's second line of defense against infection behind macrophages. So when macrophages in the body fail to neutralize an invading microbe or invading bacteria, your body will release pyrogens, which are a compound that stimulate the hypothalamus to increase the body temperature to a level that's necessary to kill off whatever has invaded the body. So there's a couple different types of fevers we're going to discuss. A low-grade fever is anywhere from 100.4 degrees to 102.2 degrees, and this is indicative of your common cold or your common viral infection. A moderate grade fever is a little bit higher. It's anywhere from 102.2 degrees to 104 degrees, and this is indicative of a little bit heavier bacterial infection. A high-grade fever is anywhere from 104 to 107.6. Now, this might cause the child some discomfort, but it's exactly what their body needs to get rid of that bacteria or get rid of that invading microbe. And it's recommended that any time while it won't cause any damage to the child, they will be uncomfortable, but it's recommended to seek medical advice for a fever above 104 degrees just to make sure that your child is okay. Lastly, hyperpyrexia. This is a serious medical emergency, and that's any fever above 107.8 degrees. And this can actually cause brain damage if allowed to persist for too long. So it's really important that if your kid's fever starts getting up above 107.8, you absolutely 100% need to get them to a doctor. But just to be on the safe side, 104, that's my level right there. That's my threshold. So fevers really aren't that bad of a thing because they're what your body needs to do to get rid of any invading microbe. All right. This is the last slide, and I hope you guys learned a little bit, but I just want to talk a little bit about pediatric adjusting techniques. When I always talk to new parents that are a little bit hesitant about bringing their kids in because they're afraid that I'm going to adjust their child the same way that I adjust them, we have to pump the brakes a little bit and have a discussion because a pediatric adjustment is immensely different from an adult adjustment. So I always describe a pediatric adjustment as three things. One, it's incredibly gentle. So the amount of force I use when I adjust a little kid is the same amount of force I would use to comfortably touch my eye. That's because these little ones, their bones are so delicate and they haven't even fused yet, and they don't require a lot of force to get them back into proper alignment, rather just real slight corrections. Number two, pediatric adjusting is incredibly specific. So you're not trying to get multiple segments to release. If I'm trying to release a kid's atlas, that's the only bone that's going to release because that's the only bone I'm contacting, and we know the exact amount of force necessary to do that. And lastly, pediatric adjusting is incredibly safe. I hope you learned a little bit. Feel free to check out the rest of the videos on our YouTube, and we look forward to seeing you again next time. Thank you.